Hi, I'm Sharon Mulvagh, and I am a cardiologist at Mayo Clinic. And I've been in the field of contrast echo for approximately going on 20 years now. I have seen contrast echo grow from the animal lab through the first agents that were approved for human use, through our everyday use in the echo lab now to make very important clinical decisions in management of our patients. In the first years when we used contrast, it was quite dramatic that we could see things in the heart that we never saw before. When we applied this into our patients, we were astounded to see the impact that it would have on our everyday practice. In the Midwest, we have some relatively large patients that come to visit us, and we know that having increased body mass size is a risk factor for heart disease, and so many of our patients are coming to be evaluated for heart disease assessment. Smoking as well is a significant risk factor for heart disease. Smoking can cause issues in the lungs that often make it harder to get our ultrasound our ultrasound pictures. Contrast can overcome these limitations. We are able to penetrate through the chest wall with our ultrasound and be able to detect the tiny microbubbles that go through the circulation. This enhances our ability to make important diagnoses of heart disease, heart attacks, blood clots in the heart, and weakness of the heart muscle. We can then determine what are the best procedures or treatments to give to our patients. Very often, we will have inconclusive tests. No longer. That's history now with contrast. We are able to make diagnostic tests. We don't miss diagnoses, and we don't have missed diagnoses or misdiagnosis, the wrong diagnosis. We want to get the right treatment to the right patient at the right time. Contrast echo is done at the bedside of the patient or in the echo lab, and we get immediate results and immediate information. There is no extra processing time, and we are able to communicate the results of our tests to our referring doctors. And this is very impactful on the course of patient progress in many situations. Pause.
Can you give some examples?
Anything else? I don't know.
This is fabulous.
Is it all right?
Absolutely fabulous.
Yeah.
But let's say a patient comes to you with a certain, can you give examples of how something might have looked and,
Sure.
and why you decided to use contrast ultrasound or the contrast agent to enhance the ultrasound image and what it allowed you to see?
Practical examples occur every day in the echo lab. Previously, we would often have to request that patients go off for a different type of testing, one where they might get radiation in the nuclear lab to be able to get information. Nowadays, we can use the contrast to be able to improve our images and be able to see the detail of the heart so that we avoid having to use procedures that require radiation. This is extremely important. We're also using contrast in the way of being able to see different chambers in the heart. Perhaps you might have had an irregularity to your heartbeat, something we call atrial fibrillation. Many times, to be able to put the patient back into the normal rhythm, we certainly want to make sure there is no blood clot or thrombus in the heart that would give a risk for stroke. When we use contrast in the heart, we can detect the thrombi or the clots more readily and know whether it's safe to do the procedure to enable the patient to go on to having the cardioversion or the jump starting back to the heart in a regular rhythm. This is an everyday application that we can use. It makes a difference in our patient management. There are lots of new applications for contrast as well, which are really an extension of what we're already doing. We can see very well when a patient comes in with a heart attack, whether or not there is weakness to the heart muscle, the exact detail of the area of the heart, of the muscle that is weak, and we are able to get more information than just the structure, seeing the area of the weakness. We can actually, with newer ultrasound techniques, which are pretty much available on every ultrasound equipment piece that we have available to us, we can actually see the blood supply in the heart muscle itself without using radiation. I think it's very important to bring the issue of radiation up. Certainly, a lot of our medical diagnostic techniques require radiation. When you go for a coronary angiogram, when you go for a nuclear stress test, these are all important pieces of information that the cardiologist may require to make a diagnosis. But many times, if we stop and we think, we are able to get a lot of information out of our ultrasound testing of the heart, echocardiogram, and that information can be accentuated by the use of contrast. On a day-to-day basis in our stress echo lab, over half of our patients that come for stress testing will use contrast because we will get better information and be more confident of the images, the results, and be able to make a diagnosis and refer the patient on for the appropriate treatment. The safety of ultrasound contrast agents has come into question over the last number of years. Certainly, I think this was mostly because of a lack of experience and knowledge and publication about the safety in the literature. As we have grown to experience over 2 million contrast use encounters in the world, we know that there is a very, very minimal risk of using contrast. Certainly less than that of the already approved agents that are used in radiology tests on a daily basis. When we use contrast, we obviously are aware of potential reactions that might be a very rare allergic reaction, but as in any testing facility, we are always prepared to be able to deal with that. I think that the thing that is most important, though, is that when you think about contrast in ultrasound of the heart, we are able to get so much more information by using the contrast. So the benefit against the very minimal risk, because it is an extremely safe technique, as has been proven now through multiple publications and very detailed testing, which has been mandated by the FDA, the safety of contrast, I think, is unquestioned. There is a small, tiny risk, which is present with every single diagnostic type of test that we do, not just contrast with ultrasound. So we feel very confident that the benefit that we get is far greater than the minimal risk, and we are recognizing the potential for any risk in any procedure that we do any day as a physician.
How does it work?
Contrast echo is a technique whereby we use ultrasound to make images of the heart, and if we can't see the images clearly, because there may be some extra tissue or extra lung or extra interference, bone, small windows that we call the window to the heart through the chest wall. If we cannot see adequately the image, then if we put in a contrast agent, which is tiny microbubbles which circulate in through the heart cavity and through the heart muscle, we are able to detect those tiny microbubbles very clearly with our ultrasound transducer. It can turn a non-diagnostic test into a perfectly informative study, which will make a huge difference often in the patient's, we call it the downstream effect. We don't have to send the patient off to another test because we couldn't find the information when they came to the echocardiography lab for the basic information. We are able to do that with the use of contrast. It is therefore often very cost effective because we don't have to do additional imaging techniques as well. Now, when we see the images and they're not clear enough, we give contrast and we are able to see very vividly all the structures in the heart that are required to make the diagnosis. Many studies now have been published which demonstrate the value of contrast in helping make the diagnosis rather than missing a diagnosis, beyond the fact of getting the correct diagnosis. A missed diagnosis is just as bad as a misdiagnosis. The accuracy, the reproducibility, that means the ability to actually repeat the test and get the same answer between different doctors that are looking at the test, has been proven time and time again when contrast is added to the basic echocardiogram. It makes the echocardiogram on the same quality level as some of these newer techniques that we have available to us. MRI or radiology using radiation-induced techniques such as CT, chest CTs. We can do with ultrasound what we can do with these more expensive and radiation-inducing tests without the radiation, with immediate feedback at much less cost. Ultrasound is such an extraordinary tool. We are very fortunate to have it as cardiologists. It is an essential tool within our toolbox or armamentarium of being able to have diagnostic abilities. And contrast has enhanced that greatly since it's been available to us over the last decade or so. There are also new frontiers that are being explored by many of my colleagues and many cardiologists around the world, expanding the basic indication of making the pictures look better and having that be meaningful in the diagnosis, but even beyond, being able to see into the heart muscle itself with the information of what exactly the blood flow is doing in the heart muscle. This can be very important in the situation of an acute heart attack, being able to sort out in the emergency room, is it necessary to go on for further, more in-depth and invasive testing or not? It is an extremely valuable tool at the bedside. We don't have to ship the patient off to the radiology department where they are potentially at risk if they're hooked up to IVs and tubes. We can get the information right there at the bedside and make important life-saving decisions.